Well, thanks for staying with us. The opioid crisis shows no signs of letting up. The CDC, or Centers for Disease Control and Prevention, notes that over the past 3 years, there's been a huge spike in deaths from opioid overdoses.
And Connecticut is among the hardest hit states, ranks 5th in the country. There's a lot of interest at the state and federal level in developing smarter policies to help combat this urgent problem. Connecticut has already passed some important legislation, including a bill that makes Narcan, the overdose reversal drug, more widely available.
Now here to discuss a bill that is still pending, we have State Representative Jason Perillo, a Republican of Shelton. Thanks for being here.
Thanks, Jen.
And also Jerry Schwab, the Chief Operating Officer at the High Watch Recovery Center in the northwestern town of Kent. Really appreciate you guys coming in and lending your time.
Thanks.
I want to start by asking on this opioid crisis. Some of the documentaries that have been produced out there show addicts going in for treatment, and they're there a month or whatever it is, and then they come out, and the evidence is that they're immediately looking to get back into it. Is there something that can be done about, reversing that so that they don't immediately go out, or the program is long enough? I mean, I don't know how long it would have to be.
Al, you bring up a good point. The recidivism rate is really high, now especially with opiate addicts, because a lot of the focuses, the lengths of stay have always been, based upon alcohol programs of 28 days, 30-day programs. When you start to look at the neurobiology of addiction, and our medical staff has studied this a lot, we're looking at more of a 90 to 100-day treatment model to make sure that, the brain chemistry that is affected by the drugs that they're addicted to has a chance to simmer down. We do some medicated assisted treatments, nothing narcotic or addictive. We're an abstinence-based program, but the state really needs to start looking at the length of stay and how long these people are in treatment. The old 30-day programs with regards to the opiate addiction and opiate treatment isn't going to work. I mean, we need to start focusing on 90 to 100-day stays.
Is there anything else that you wanted to relay to lawmakers? Length of stay, one of them. Is there another one that is at the forefront?
The governor's office and the legislature has been very good. We've been communicating, having meetings up at the Capitol to discuss the issues and some of our expertise and what we've seen in our patients. And, the state's done some really good things. I mean, a lot of our biggest issue now is access to care. The Medicaid population in the state of Connecticut is significantly underserved. The governor put in a proposal.
And it could get worse depending on what happens at the federal level.
Correct. As the funding, gets cut from the federal level and from the state level budgets being tight, the facilities that depend upon the Medicaid dollars are drying up, and the population that's addicted to the opiates is increasing. So the governor did a good thing a couple years ago. He put in a requirement, the legislature agreed and passed it, that would require any new services coming into the state of Connecticut or any existing service facilities like ourselves at High Watch. If we applied for new or expanded services, we had to show to the state that we would serve the Medicaid population, and that was a big increase for the state of Connecticut. It'll start seeing the benefits of that over the course of the next few years as facilities grow and as new services come into the state.
Representative Perillo, this is not a partisan issue,
not
right?
At all. Not at all.
You're a Republican, but Democrats, Republicans working together on this?
Yeah, it's one of those issues where Democrats and Republicans in the legislature and the governor's office can actually get together and get something done. Imagine that. So we've been working very closely to pull together a lot of really good ideas to package it together into a piece of legislation that will work, that can pass, and we're making very good progress. It's been a very good experience to try and work on something that generates a real impact for folks.
What's the biggest thing about this pending bill now, which is sitting where? Is it sitting on the House on a House shelf somewhere in the House of
There's a House bill, there's a Senate bill. We're working on putting them together. Yeah.
The main provisions?
Much of the focus is actually on the front end in terms of educating physicians and educating patients about the impacts of opiates and addiction. We believe, quite frankly, that there are still a lot of physicians out there that are overprescribing, and we believe that there are a lot of patients who really don't fully understand just how addictive some of these narcotics can be.
Why are they overprescribing? If they know, I mean, everybody knows about this crisis. Why are physicians continuing to overprescribe?
Honestly, it's shocking, and
are they getting money, kickbacks from the pharmaceutical companies, or to push more prescriptions and more pills? I don't know. Just the average person out there is kind of scratching his or her head too, trying to figure it out.
Yeah, I don't think that's the case. I think that physicians are still a little loose with the prescription pad, and
they just want to make the patient happy. You mean that kind of thing?
Yeah, well, and the reality is there is a place for pain medication and treatment. There certainly is, but the devil's in the details and how much you prescribe and over what length of time you prescribe it.
Right. Now, this governor's bill would be more about electronic prescriptions, right, to reduce fraud so that people can't fraudulently be writing it out. He passed legislation, though, last year you guys did. This would build on that.
Correct. The legislation that's proposed right now would require that any narcotic prescription be transmitted to the pharmacy electronically rather than the old school written prescription, which does create opportunity for abuse.
All right. Now, it also says allowing the Department of Consumer Protection Commissioner to share certain prescription drug monitoring program information with other agencies for studies involving drug abuse.
Right. We have a prescription drug monitoring program in place now that does help to track which patients are utilizing which medications. But that sort of exists in a bubble. This bill would expand that and allow other agencies that information, which will really, we believe, will help us control some of the problem.
And this bill stands where right now? It's going to be acted on. You're confident before the end of the session?
When you've got an issue like this that does have bipartisan support and support from the governor's office, it ought to pass this session. A lot of folks are focused on it and working on it
So you're
right now.
confident that high percentage that it will pass?
I am,
okay.
yes.
We only have like 10 seconds, but do you think this problem is getting worse? I mean, we had heard that it was still getting worse in Connecticut. Are you seeing it level off, or do you think it's going to?
No, I think it's definitely getting worse. I think the legislature is putting in some stopgap measures that'll help just kind of slow it down. But then we also need to treat the population that's currently addicted. So it's kind of a two-pronged approach of addressing the issue to stop the numbers from increasing and then treat the population that we do have.
Okay.
All right,
Thank
Mr. Schwab.
Thank you.
Appreciate it.
Representative Perillo, thank you.
And don't forget, if you missed something on The Real Story, you can watch it by going on to our free Fox 61 News app.
Thanks for watching this week's edition of The Real Story.